Hello students, Amit Gill here. Today we are going to talk about the muscles of pelvic. So in my previous lecture I have already taught you about what is pelvic girdle. So that was the structure of anatomy of the bones of the pelvic girdle. So today we are going to talk about the muscles of pelvic. So the pelvic, so I'm providing you notes as well as the diagram so that it becomes easy for you to understand. So coming over to the pelvic muscles. So the pelvic muscles or the pelvic viscera, which contains bladder, rectum, pelvic genital organs, and terminal part of the urethra, reside within the pelvic cavity or pelvic girdle. So I have already taught you about the pelvic or which is known as our hip bone. So our hip bone contains, or the pelvic viscera contains bladder, which contains all our urine, and rectum, through which all the feces or stool comes out, and pelvic genital organs and terminal part of the urethra. So these are the visceral organs present in the pelvic cavity. So a number of muscles help make up the walls of the cavity. So there are a group of muscles which make up the covering of the pelvic cavity. So the lateral walls include the names of, now I'm going to tell you about the names of the muscles, and a number of muscles help make up the walls of the cavity. The lateral walls of the include the obturator, internus, and the piriformis muscles, with the latter also forming the posterior wall. So the muscles which are known as the obturator, internus, and piriformis, these are the posterior muscles or posterior wall muscles. And in this, the pelvic floor muscles is also known as the pelvic diaphragm. So we can also call it, these muscles are also known as the pelvic diaphragm. Now next, we come over to the pelvic floor muscles. We will go more deep into pelvic floor muscles. The pelvic floor muscle is a funnel shape. So it is a funnel shape. You have seen like a V shape. The shape of the funnel is like, if you see it from the side, it will look like a V shape or funnel shaped structure. It attaches to the walls of the lesser pelvis, separating the pelvic cavity, the perineum, inferior region of genitalia and anus. So it separates the pelvic cavity from the perineum inferior region of the genitalia and anus. So anus, from where you pass over your stool, so it separates the anus area or the genitalia area and the pelvic cavity. In order to allow for urination and defecation, there are few gaps in the pelvic floor. There are two holes that have significance. So our pelvic girdle has two holes, which is known as a urogenital hiatus, an anteriorly situated gap which allows passage of urethra and vagina in females. So there is a passing of urethra from which urine is passed out, and the female organ which is known as the vagina. And rectal hiatus, it is centrally positioned gap which allows passage of the anal cavity. So anal cavity pass through the rectal hiatus. So anal cavity is the cavity through which we pass our feces or stool. Now between the urogenital hiatus and the anal canal lies a fibrous node. So we have already taught you about the urogenital hiatus, through which the vagina passes and urethra passes, and rectal hiatus through which anal canal passes. So both this urinal hiatus and anal canal lies a fibrous node. So there is a muscular fibrous node which is known as perineal body, okay, which joins the pelvic floor to the perineum. So this fibrous node, which is known as the perineal body, it is responsible for the connection between the pelvic floor to the perineum. So next, coming over to the functions. What are the functions of the muscles of pelvic floor? So as the floor of the pelvic cavity, these muscles have important roles to play. So these muscles help support in abdominopelvic viscera, which is bladder, intestine, and uterus, etc. So it supports bladder, so our hip bone or a pelvic cavity, it contains bladder, intestines, and uterus. So it supports these organs, these visceral organs. And another function is resistance to increase in intrapelvic abdominal pressure during activities such as coughing or lifting heavy objects. So it also supports our abdominal and pelvic area, because when we cough or when we sneeze or whenever we lift any heavy object, so there is a pressure over our hip area. So it maintains the resistance to increase in intrapelvic abdominal pressure. So the gap between the pelvic area and the abdominal pressure, it maintains and it supports. So, and third is urinary and fecal continence. The muscle fiber has sphincter action. So what is known as the sphincter action? When the muscles relax, when the muscles of the pelvic relax, we are able to urinate, and defecation, like we can pass stool when the muscles relax. Now, muscles. When learning about the muscles of the pelvic floor, it is important to keep in mind it is funnel shaped structure. So I have already told you that the muscles of the pelvic are funnel shaped. So the main components, three muscle groups make up the pelvic floor, which is known as the levator and muscles, which is the largest component. It is a broad sheet of muscles. It is composed of three separate paired muscles. So for the levator and muscles, it is a broad sheet. It covers the most area of the pelvic. So the name three muscles which make up the levator and muscles, they are pubococcygeus, puborectalis, and iliococcygeus. And another is coccygeus muscles. It is the smaller and most posterior pelvic floor component. And the last part is the fascia coverings of the muscles. So fascia is the all over covering of the muscles. So I hope students and my friends, this concept is clear with you. And if you have any doubt regarding these sessions or anything which is not clear to you, you can put your questions in the comment box, or you can put it in the group so that I can explain you again. Thank you so much. God bless you. Take care.